Good evening and welcome. My name is Jillian Kumagai, and I'm the Director of Stanford Health Libraries and Community Support. Thank you for joining us for our talk, Coping When Caring for Adults with Chronic or Serious Illnesses. Please enter questions in the Q&A box at the bottom of your screen, and Dr. Trivedi will answer as many of those as possible. It's my pleasure to introduce Makund Acharya. Makund is a social entrepreneur and healthy aging advocate based in the San Francisco Bay Area. He is the founder and executive director of Sanjay's Touch, a nonprofit organization that provides grants to improve the quality of life of patients and families dealing with serious or chronic illness. He co-founded Sukham, a nonprofit organization that advocates healthy aging, living well, and preparing for life's transitions in the San Francisco Bay Area's South Asian community. He currently serves as Sukham's president. As a volunteer at Stanford Healthcare, Makund supports palliative care efforts, is a patient family partner, serves as a patient voice on hospital committees, is a caregiver support coach, spiritual care volunteer, and fall prevention balance instructor. Makund is active in many local organizations, including Mission Hospice, India Currents, the Hindu Community Institute, the Alzheimer's Association, and others. Makund has a long list of professional accomplishments from his career of over 40 years in the aerospace arena. And Makund, I will turn it over to you.
Thank you so much for that kind introduction, Julian. And good evening, everyone. I would also like to welcome all of you to today's presentation, brought to you by the Stanford Health Library in Sukham. We at Sukham are very happy to be collaborating with Stanford to bring webinars such as this one to the community. As Jillian mentioned, I'm currently the president of Sukham. We are a small all-volunteer nonprofit organization based in San Francisco Bay Area. And our mission is to promote the practice of living and aging well while preparing for life's transitions, including culturally sensitive care for chronic and advanced illness in the family and friend circle. We offer information, resources, and support in healthy aging, as well as preparing for life transitions and coping with or caring for people with chronic or serious illnesses. Our goal is to help people navigate and overcome cultural and informational barriers and access resources that promote a dignified, healthy, and happy life. Our focus is the South Asian community, but we welcome one and all. And now it's my pleasure to introduce the speaker for today, Dr. Ranak Trivedi. Ranak is a professor of psychiatry and behavioral sciences in the Department of Public Health and Population Sciences at Stanford. As a clinical health psychologist and a health services researcher, Dr. Trivedi envisions a culturally attuned healthcare system that is not only patient-centered, but family and friends-centered as well. And she has a special word for that. She calls it family. Such a system would engage and empower both family members and friends in navigating the healthcare system on the patient's behalf while receiving the culturally attuned support and services that they need. Ranak serves as the Director of Caregiving and Family Systems at Stanford Center for Asian Health Research and Education, or CARE, and is a core investigator at the Center for Innovation to Implementation at the Veterans Administration in Palo Alto. She leads a program called South Asian Family Approaches to Disease, or SAFAD, which aims to improve healthcare delivery by supporting culturally diverse caregivers of seriously ill patients. In other words, Dr. Trivedi is the perfect person to give today's talk. Ranak, it's over to you.
Thank you. Thank you, Makund, and thank you, Stanford Health Library, for inviting me, and thank you all of you for spending such a late hour on a Tuesday hearing this talk, and I hope that it is worth your time. So today I'm going to talk about what it's like to cope when you're caring for an adult with a chronic or serious illness. As you probably heard from the introduction of my bio, my focus is with adults. Obviously, a lot of these issues are also relevant if you're caring for somebody who is a child or a youth or young adult who is also facing chronic or serious illnesses. Just want to state that I have no financial conflicts of interest to declare here. I want to start by sharing a story that about caregiving, which is, it's always personal. These are my parents. My mom is a 20+ year survivor of cancer and has been managing metastatic breast cancer for about 17 years at this point. My father, like many of us who are South Asian, was diagnosed at a very early age with hypertension, other coronary artery diseases. And we've as a family have been managing that for basically most of my life. One of the things that has been really striking about how they've navigated both these chronic and serious conditions is how they've supported each other. And I've seen this firsthand. And as a clinical health psychologist who was interested in how psychosocial factors affect outcomes, this has become my, not only the research focus, but also my mission, which is to provide supports to communities so that we can advocate for ourselves, but also educate healthcare system and healthcare leaders so that we know how and when to engage family members in all aspects of care. Just a quick overview of what do we mean by chronic and serious illness. I think generally we have an idea what that is. But these are conditions that are generally multi-year and often tend to deteriorate over time and require a lot of maintenance. Serious illnesses can also be multi-year. Sometimes they are not, unfortunately, sometimes you can be diagnosed with a serious illness and it's terminal at that point. But many serious illnesses are increasingly becoming multi-year processes, things like metastatic breast cancer, for example. Common ones that we think about are heart disease, heart failure, COPD, chronic obstructive pulmonary disease, end-stage renal disease, as well as mental health conditions, which, as we know in the South Asian community especially, is heavily stigmatized. Just to kind of put some numbers, because while a lot of you are here from the community, as Makund mentioned, Sukham has a South Asian angle. So for those of you who may be interested in why this is important, in India in 2019, these are the latest statistics. And as you can see, the number of people in the top most deadliest conditions are ischemic heart disease. So, and the first few are all chronic or serious conditions, all the way until diarrhea, where that is the one, which is fifth, is the one that is not considered chronic serious illness. So you can see that the prevalence and incidence of this chronic or serious illness in India is also very high. If you look at US numbers, about 60% of US adults have at least one chronic condition. Again, these are things like heart disease, could be hypertension, could be pulmonary COPD, any of those. About 28% have a 3 or more, and 12% have 5 or more chronic conditions that they are managing. So that's roughly about 15 million people. And as you can see on the right side, the percentage of healthcare spending devoted to these groups is quite large. So 90% of the healthcare spending in the United States goes towards managing chronic conditions. Now, these numbers, as you might realize, predate COVID. And obviously, we have spent significant amounts of funds in the last 2.5 years managing an infectious disease. I do not have those numbers, but those numbers, these are pre-COVID numbers. And managing these conditions is pretty hard. So a lot of these conditions, as you're thinking about in your own life or people you know, they mostly often require some adherence to some medication routine. It could be one medicine. As the number of health conditions increase, you often have more than one medication that you're managing, as well as you may have, for certain conditions, may just require multiple medications. Often there's some lifestyle recommendations, typically around exercise and diet, and that varies by the chronic condition. There's monitoring symptoms. So for example, keeping an eye out for worsening symptoms with an action plan to what to do. So for heart failure, you have to weigh yourself daily, for example. And if you see a rapid increase in weight, that could mean that you're building fluid, which means that you either need to take a diuretic or you may need to go to the emergency room for some IV treatment. Preventive care is high on the list of self-management, things like getting your flu shot. Now, of course, COVID vaccinations, COVID and the boosters. But we also know that having chronic conditions worsens our mental health as well as physical health overall. It lowers our sense of well-being and it increases the risk for depression. None of this actually factors in the contributions that caregivers make as they help navigate these various conditions. So often it's the caregivers who are helping manage medications or encouraging people to exercise or preparing the meal or monitoring the symptom or getting people to the preventive care. So what do we mean by caregivers? So I use the term, as Makund said, I like the term family, and caregivers are family. They're family members and friends who are providing care and support to adults or kids with medical or mental health conditions. And the reason I like the term family is that sometimes people do not see themselves as caregivers. It's not a term that resonates. Also, sometimes we are taking care of somebody because we're related to them, we care for them, like we love them in that sense. And it's not really clear when you sort of officially can tip over into what we would define as caregivers. As of 2020, there was 53 million adults who identify as caregivers in the United States. And these are data that have been collected by the National Alliance of Caregiving along with AARP. 2020 numbers, and this has very much gone up, although we don't know the number yet. They're still working on those projections. But $470 billion of unpaid services are provided by caregivers as they care for adults with chronic or serious health conditions. Now, that's a lot of zeros for me. And so I personally have a hard time wrapping around that number. So I can share that these are the market caps for these multinational companies that we are quite familiar with. And as you can see, that if caregiving was a company, it would be a Fortune 100 company. That is how much unpaid care is provided in this country by adults. Caregivers are critical to self-management success. There's a lot of evidence showing that for people who do not have somebody who they can rely on, they tend to have worse outcomes overall. And the ways caregivers help is by playing multiple roles. They can provide emotional support. So we can provide emotional support. This could involve talking by phone, in person, visiting, kind of being a shoulder to cry on, being somebody to boost somebody up. They could provide instrumental support. So they're practical things. So they can be the ones picking up the medications or supporting people by taking care of their hygiene. A lot of people who have a chronic or serious condition are unable to carry out what's called the activities of daily living, basic things like bathing and feeding themselves and dressing. And caregivers may provide that kind of care as well. Increasingly, we have been moving our serious illness care to outpatient settings, which means that a lot of the medical stuff that was being handled within the hospital systems are actually now being pushed out for caregivers to care for. So these involve complex medical tasks that often are nursing level tasks, like providing wound care, dressing changes, giving injections, biologics, things like that. So, and this trend is going to just go up, especially in serious illness care, for two big reasons. One is patients often prefer that they receive their care at home and not go multiple times to a hospital setting or a clinical setting. And it's also cheaper for the hospital system if this stuff happens on the outpatient basis than an inpatient basis. A less studied but a very critical role that caregivers can play is care coordination. So a lot of times, and you may see this in your own lives, that caregivers are actually on hand. They're the ones who sort of understand the different specialties. They're kind of coordinating across services. If somebody has a heart failure related visit and a cancer related visit and a primary care visit, often the caregiver is the one who's managing the logistics For people who have been hospitalized, it's often the caregivers who are provided the discharge instructions, what needs to be taken care of when people get home. And caregivers also play critical roles in patient advocacy, making sure that patients' voices get heard. Sometimes it's because patients can't speak for themselves, and other times it's because caregivers can serve to amplify when patients don't feel like their wishes are being heard by the healthcare team. These are obviously a lot of things, and it comes at great emotional and financial cost to caregivers. It is estimated that caregivers spend on average across the country about $7,000 a year out of pocket. This could be gas costs to get people, obviously that has gone up. So this number obviously would in the current time reflect the really high gas prices, as well as things like helping with co-pays of medications and clinic visits, helping with food, all kinds of different ways. Certain conditions, especially cancer and dementia, tend to be quite a bit more expensive to handle, and the out-of-pocket costs for caregivers are significantly higher for those groups. There's also an increase in emotional toll over time as people generally deteriorate over time, as the intensity of caregiving increases, where the patient becomes increasingly disabled, unable to care for themselves. And so there requires more and more support from the caregiver. So you can see that this, if left unchecked, if left unassessed, it can become a significant challenge for caregivers. This is just a chart that I grabbed from the Caregiver in the US 2020 report. So this is a comparison between 2015. They do these surveys, nationally representative surveys, every 5 years. And it just so happened that the last one came out right before COVID. And so it'll be really interesting to see what the 2025 one looks like, because they'll be starting to collect those data in the next year or so. But be that as it may, in the 5 years, there was about 9.5 more caregivers compared to 2015 as there were in 2020. So while 18% of the adults identified as caregivers, this increased to 21%, so about 1 in 5. So there's nearly 1 in 5 are providing unpaid care to an adult with health or functional needs. These are some really interesting statistics. More Americans are caring for more than one person. Again, we have some preliminary data from COVID-related survey, and that number has only gone up. So people may provide care to their partner as well as maybe their parent, that type of thing. More family caregivers are reporting difficulty coordinating care. So while in 2015, about 1 in 5 said that they had difficulty coordinating care, in 2020, 1 in 4 said that they had difficulty coordinating care, slightly more. And there's an increase in dementia and Alzheimer's disease or related dementias. And as those numbers have gone up, the caregiver stress in dementia in particular can be very hard to manage. And then distressingly, this has resulted in more family caregivers reporting that their own health is fair to poor. So people are not really able to take care of their own emotional needs. And about almost 1 in 4 say that caregiving has made their health worse. Family caregivers tend to be women, 2 in 3 tend to be women, but of course 39% are men. And so caregiving is truly an every person issue. And this of course is a binary of the gender identities, doesn't factor in other gender identities. Caregivers also report that they have taken a financial hit as a result of their caregiving responsibilities. Nearly 50% say that, and 61% say that being a caregiver has affected their work life. More statistics to think about for us as we kind of think about the ways in which our society is changing. The number of caregivers available per adult over 80 years was 7. There's 7 adults available for each one person over 80 to be a caregiver. That number is dropping. It'll be 4 to 1 of a ratio in about 8 years. That's 2030 sounds a lot more in the future than it is right now. And by 2050, that number will drop. So that means that increasing amount of burden on caregivers as there's less caregivers to go around. Caregiving has been studied very widely. I gave you a lot of information about the kind of downsides of caregiving. However, there are very important cultural dimensions of caregiving which are important to think about. So there's a lot of literature, mostly among African-American communities, some on Hispanic, and very little on Asian communities. What we know is minorities, racial ethnic minorities provide more hours of family care, are more likely to provide intense care compared to white Americans. They also report worse physical outcomes, but they also have a wider network of family and friends who help. So a lot of the minority cultures identify as collectivist culture, racial and ethnic minorities, I should say. They identify as, they're from collectivist culture, which means that the individual's needs are not as important as a collective need. So if somebody's in need of help, more people are expected to do their filial duty or their duties to take care of one another. And so they have a wider network of family and friends, but the primary caregivers tend to still get worse outcomes. Caregivers, the help-seeking behaviors can vary, which is an important mental health issue. So mental health issues are often stigmatized among South Asians and other minority cultures. And for example, Asian Americans are less likely to seek professional help when they experience behavioral challenges. So these kind of can intersect so that caregivers in these communities may struggle more, but not seek help in a timely manner. Within the South Asian countries, so South Asia, when you think South Asian countries, there's 7 countries, which is the map on the side. Worldwide, there's about 1.9 billion South Asians. They follow all major world religions. There's a lot of spoken languages. There's a lot of shared cultural experiences, such as collectivism. However, there's also incredible amounts of heterogeneity within these countries. And I've already touched on the South Asians being a collectivist, which becomes an important dimension of caregiving. And the motivation and expectations of caregivers are absolutely culturally embedded. There's a lot more intergenerational care that you observe when you think about Asian or South Asian caregiving. There's also more youth caregivers. This is a growing area of attention in the health and policy world because there's a lot of people under the age of 18 who are providing pretty significant care, but they kind of become even more invisible than the adults. And in multi-generational families that are living together, often the kids who are younger than 18 are pulled into caregiving tasks. You might remember that I said that in the United States as a whole, 61% of caregivers are women. These data from India, from a survey called HelpAge India, showed that actually in India, 80% of the caregivers are women. There's significantly more caregivers who identify as women in India compared to the US. It's also the relationship is different. So in the United States, the caregivers who are women are often the daughters or the wives or the spouses. In India, the caregivers are often the daughters-in-law and then daughters. There's this idea of seva or service that comes. It's kind of considered that providing service to a human is the equivalent to providing service to God. And so people are expected to really feel grateful at the opportunity to caring for somebody else because it's equivalent to doing religious rituals. But because of that cultural expectation, it's harder for people to talk about when they're feeling stressed out and burdened because they may come across as seeming ungrateful for this experience. And then, of course, there are barriers around health literacy and language barriers that can impede people's understanding of the current processes, what are the current conditions, and what is expected of caregivers and the patients as well. And as we all probably recognize, the healthcare system is not designed to handle this cultural context. While data from South Asian countries is not quite as rigorously collected or available, the the general patterns track, which is a lot of people are providing significant 10 hours per day of caring for patients. So that's more than a full-time job. People reported depression in this one study, especially if they were caring for a partner, if they lived with the patient, if they were responsible for the household chores, financial support or transportation, and of course, provided more care. And then in this particular study, basically everybody experienced, reported some stress, 18% reporting severe stress. However, after saying all these statistics about all the downsides of caregiving, it also must be noted that caregiving can also bring incredible joy. The joys of caregiving, so there's in a study that was done about 8 years ago now, almost all caregivers reported some positive aspects of caregiving. And there's some research showing that significant others report both more stress for being a caregiver, but also report more uplifts compared to other relationships like children or sons and daughters-in-law. Why are people experiencing positive effects? People experience the rewards of helping someone who is in need. They find that they're having the growth they experience in the roles and responsibilities can be affirming and a positive feeling for people. People also do some benefit finding, such as they're spending more time with their loved one. Caregivers may report that they have a meaning and purpose that is wrapped up in their caregiving responsibilities in a way that wasn't before. And then there's also this idea that they might feel like they're role modeling for the next generation how care should occur. So I wanted to take a minute to talk about how to increase joy and reduce stress. Obviously, stress is an important dimension, as is joy. There's a lot of guilt that gets wrapped up, especially if you're kind of told that this is something you should feel grateful for. So combating thoughts of guilt when you do not feel like providing care is important, so you don't beat yourself up. When possible, communicate your needs and boundaries with the care recipient. A lot of our work has actually shown that the communication between the individual who needs the care and who provides the care can be really important in kind of level setting how people collaborate with one another. And the more people communicate, the more they're likely to collaborate around the different needs and have more empathy for one another. And the less they communicate, that would be less. Develop a schedule, especially if you're providing intensive caregiving, a lot of hours of caregiving. Create a schedule that allows you to take breaks, either getting help from people, other family members, friends, or getting paid help like nursing aid, especially if it involves somebody who requires around the clock monitoring, to making sure that you're not just the one person doing all of it. There are a lot of support groups out there that you can tap into. At the end, I'll also share some website and resources that you can look up, and these slides will be available, or you can just contact me directly and I can send them to you too. It's also important to focus on strategies to increase joy, such as benefit finding, using humor, developing a partnership with the person who is the caregiver and the care recipient. And then finally, you definitely want to keep an eye out if things start feeling really overwhelming. Then it's get help from either your primary care provider or somebody like a psychologist or a counselor or pastoral counselor to both prevent or address feelings such as depression, stress, or burnout. So I want to take a couple of minutes to share a little bit of just a high-level overview of some of the work we are doing right now. Makund touched on that, but our goal is to improve healthcare delivery by supporting culturally diverse caregivers of serious ill patients. This program is called Suffered, which in Gujarati, which is my mother tongue, means success. So we really want to set people up for success. The current project we have is to understand the experience of South Asian women and their family members living with breast cancer, and then understanding what the healthcare system can do to address the cultural needs by also interviewing providers. You can check out our website, which is a peer suffered study sites at Stanford ED to learn more about this. We're kind of wrapping up the first phase and now launching the second phase. And then finally, I just want to end with, because I know we had a lot of questions come in as people registered, so I want to leave enough time to address all those questions. The former First Lady, Rosalind Carter, who's been an incredible advocate of caregivers and started the Rosalind Carter Institute for Caregiving based out of Atlanta. She has a quotation that is really telling. It says, there are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. So with that, here's a bunch of resources that I can leave up for people if they're making note of it. And then I also just have my contact information if people want to reach out to me. And with that, I am happy to start answering questions, Makund.
Thank you for that presentation. May I encourage those in the audience, if they have questions, to keep them coming in the Q&A, as Amy pointed out, so we can get to them. But let's start with some of the questions that have already come in, Ranak. You talked briefly about coping strategies for people who are caregivers, but sometimes I guess we have to talk to one another to induce ourselves to adopt some of those strategies. So the question here is, how would you start a conversation with a client or a family member about coping strategies for a chronic or progressive illness? How would you get them to approach that topic, which is sometimes difficult for them?
So I think it's a little bit different if you're as a client or family. I think maybe I'll just decouple the two. And it's a great question. With a client, it can be part of the assessment. And in fact, I would recommend that if you are a behavioral health provider, that and part of your intake, it'd be useful for you to ask people if they are providing care to somebody. And it could be a caregiver, that could be a child which has no healthcare issues, but their children just need a lot more care and support than adults do. And then also further assess if the people who they provide care are have a serious or chronic condition. Having that information can be really important, because that will open the door to target some assessment around how they're not only coming in with whatever concerns they might have as a client, but also to specifically ask them if the caregiver role is leading them to causing them to have stress or guilt or other challenges, as well as ways in which they can that they're deriving joy. An important way to then take that conversation is also try to assess what people used to do before they took on this caregiving role, what used to give them joy. It could be hobbies. What is it that they're grieving? Sometimes people start grieving the loss of the relationship they had with the care recipient because they no longer can do the things that they used to do together. If somebody has a cognitive impairment, they're already the people start, they're shifting their identities. So caregivers start grieving that as well, that the loss of the person, even though they're physically alive, but cognitively fading and not the people they used to be. So that's one, on the client side, that's one important way to probe for that specifically. It's somewhat similar if it's a family member. If you sort of notice that somebody is feeling stressed and overwhelmed, or you just know that somebody has that, even if you haven't noticed any changes in how their demeanor, recognize that if somebody is caring for an adult with a serious or chronic condition, then opening the door to have that conversation and normalizing that it can be stressful, it can be tedious, it's not how people often want to spend their time. They might have some conflicts with the person because they disagree on who should do what. And keeping those channels of communication open, like being an advocate within your family and friends network to allow for those conversations to occur. Sharing that this is it's common. Often what we hear is caregivers find that they're very isolated. They don't realize that there's many people, billions of people or millions of people who are providing care, and that a lot of them feel stressed. So they feel like maybe they're just bad people because they should be experiencing gratitude and love, and instead they're feeling stress and burnout. And just recognizing that in telling them that that's not true can open the door to that conversation as well.
Good, thank you. There's a couple of questions that came in related to what you just, the answer you just gave. You may have actually covered one of these in part, if not all. So let me read the first one to you. So you talked about a number of different emotions that a caregiver can have. You mentioned guilt and resentment and so on. You also did mention grief, and you talked about grief particularly now. So whether it's grief for a life that was lost or grief for an expectation of a loss to occur, are there any specific things you would do to help someone be coping for this grief, or to understand why they're having those emotions that they do?
For the professional behavioral health providers, there's a whole arsenal of tools that we have at our disposal around, cognitive behavior techniques, challenging the thought, having time for reflection, and sharing. Sharing can also be cathartic, just to have that on the open. If you're helping a family member or friend, I think the single most important thing you can do is validate that what they're experiencing is true, and that what they're experiencing is real, and that it's okay to feel whatever they're feeling. A lot of people may not actually be able to articulate that their grief, where their grief is coming from. So helping them with that, having that conversation so that you can help them say, well, a lot of people do feel grief, not just because somebody has died, but you're mourning the loss of a relationship you had, or mourning the loss of a future that has now changed. Maybe you had plans to travel the world, and now you're kind of have to stay home and can't travel very far because you have these treatments you have to go through. So giving people that language that is grief and that is sadness may also be very helpful, because people may not be able to label that in that same way unless prompted or kind of given that language. There's gratitude can be a tough one to be thinking about when you're especially under a lot of stress, but there's a lot of evidence that is growing that thinking about things that you're grateful for on a daily basis, on a regular basis, and reflecting on that, journaling about that, can also help increase the positive experiences. Because when you're in these moments of stress, when there's so much happening, you're kind of front and center of your brain is consumed with managing the logistics, or getting people to their appointments, or kind of managing all your different responsibilities. But then spending some time in the morning or at night in some reflection, that all of the things that you're grateful for, something that happened that day that made you smile, things like that can also just refocus your attention on some of the things that sometimes remain invisible because they're not as prominent as the things that are adding stress to our lives.
So I guess everyone has to try and figure out what works better for them. Try a couple of different things, perhaps, and like writing gratitude journal or self-reflection are a couple of things that you just mentioned. So.
And I have to say, the gratitude journal is something that, if you haven't tried it, I highly recommend it. It's also something that you can teach children to do. I have a young child, and since she was about 3, we've been asking her, what are 3 things that made you smile? Because gratitude is a pretty big concept for a 3-year-old. And that's just become a daily ritual for us to ask that. And I think that it just sort of has given her the lens that no matter how, as the older they get, the more they have disagreements with friends and other things that happen. But it also just, towards the end of the day, refocuses the attention on some of the positive things that have happened during the day. So if you're listening and you have young children, do not fear, you can do this with kids too.
Then going back to the conversation, one viewer asks, how can one start a conversation with adult children who want to help a parent with the chronic condition, but are not very communicative with their methods?
let me think. I think what
I think
the person, yeah, go ahead, Makund.
I would say perhaps what they're trying to say is the children are not very communicative about what they're thinking and feeling,
I
because
see.
they don't want to uh, to share that with the parents. And so this perhaps, this is my interpretation, this perhaps causes difficulty for the parent to reach out and talk to the adult.
Yeah, I took it slightly differently, so maybe I'll answer both ways. So, with the best of my ability. So I think that I think a lot of the things get wrapped up in this caregiver term, which is why I like the term family, because it sort of implies there's a caregiver and a care recipient. But if we change that a little bit to say it's two people or more than two people who are navigating this healthcare or illness together, I think it becomes more of a partnership. So if there's an adult child who wants to help, but doesn't know how, then having that as a partnership and having an open communication can be really helpful. Now, sometimes it's different. What people can do when they're living close by is different than when they're at a long distance. So if there's more than one caregiver, or if there's caregivers at a long distance, they can say, well, I can't really be there to kind of do your dishes for you today, but I'm happy to call you. Would it help if I talk with you every day? Or you can just call me whenever you feel like you're down and I'm available. You can help do care coordination at a distance, because people can join clinic visits and listen to what the providers are sharing. And especially, now it's even becoming even more common to have these virtual visits. So even easier to add people in that. And then asking, and never, asking what can be helpful. And that may change over time. And also being patient with the person who's going through the health conditions, and then the person with the health condition being patient with the caregiver and having more of a trust. The other piece that you mentioned, which is the emotional, if you're struggling with the emotional aspect of seeing a parent suffer or having a health condition, and again, maybe feeling some preemptive grief around that, or sort of losing that image of a parent who was strong and physically able and now is looking more frail. I think having the same approach of communicating with them, but communicating with your own network of friends and family, to say, wow, I went and visited dad, and he looks so frail, and that that's so, it just made me really sad. And then being on the lookout for people who may be experiencing, especially as more and more people are visiting. In the COVID era, it's been like a big gap of time, so people haven't seen each other for 2 or 3 years, and now they're suddenly seeing them. They've seen them on FaceTime or whatever, and they suddenly see, I've been hearing a lot that people sort of see, and they're kind of shocked at how frail their parents have gotten, and how unwell they look. And I think that all can be important to process with either for other friends and family, or with a mental health provider if that's necessary.
Okay, good, thank you. So this brings me to the next question that I'd like to pose to you. And this has to do with many of us first and second generation immigrants in this country who still have family overseas. So if the patient is overseas, how does one manage work and family life here in the US and time off to manage responsibilities and balance a career and so on? So there's a lot of different tugs and pulls here. Absolutely. So any thoughts on that?
I can give some sort of strategies. Obviously, each situation can be very different. It depends a lot. And, this is, like you said, Makund, this is such a common thing that now we are seeing, people who have parents who are in India, they're here and they're trying to balance it. Either the parents are being asked to move here, or the parents don't want to move. And so they're trying to juggle all this. I think having first of all, let me just say that's hard. So just to whoever asked the question and whoever's thinking that this question resonates with them, just know that what you're going through is hard. Long distance caregiving is very stressful. It's, you feel out of the loop when you're there, you feel torn. If you have family here and you want to visit, go back and forth, there's a financial challenge to that. It's also, your family kind of missing you here while you take care of your kind of family responsibilities in another country or another state. So it is really hard to do. Having sort of a structure around it, again, having a clear sense of what is it that you're able to do. Hopefully the family themselves may have some buy-in about the limitations and the tensions you're experiencing. There might be people that you have to deal with who will say snide things about how good of a child you are and what responsibility you're not doing. And I think having a little bit thick skin and deaf ear to some of those things, just knowing that you're doing the best you can be helpful. If the financial piece is a real one, for tickets get really expensive, the time difference gets really expensive. Regular communication is, I keep coming back to that. I think regular communication is very important to understand what are the needs that people have and how much they can coordinate at a distance. One thing I also should mention is that for some serious illnesses where people are really needing a lot of intensive care, including food delivery and things like that, there's some really neat websites that are out there. I can quickly dig something up and put in the chat, or just back channel me if you're interested, where you can actually have a family member be the point person for coordinating the different activities and say, like on Monday morning, so-and-so will drop off breakfast and sign up for different things. On Tuesday, so-and-so will take this person to the doctor's appointment. So I think having that kind of high level coordination and accepting help from anybody who offers it is also important. I think there's a tendency to try to do it all ourselves. And for certain conditions like cancer and dementia, there's still so much stigma that people don't want to involve extended family or friends because they don't want to share that they're dealing with these serious conditions. But then that, being more transparent about that and about the need to get help can be really useful.
Mm-hmm. Great. So I guess in a sense, the message is also one you can extrapolate that if we are, and this is the message that Rosalind Carter just gave at the end of your talk, right? If at some point or the other, we are likely to find ourselves in the state. So thinking ahead and planning for it and getting some structure in place beforehand may be something worthwhile doing. Do you have any thoughts on that? Looks like, Ranak, you may have frozen here for a bit. There you go. Okay.
So are you asking sort of proactively putting some structures in place?
Right. Let's say there's a parent who is now in, pick a number, in their 60s, and the next 10, 15 years, you expect something to happen or likely to happen, be prepared.
Yeah. And I think having those conversations early and often, just say, what is it that what are your wishes? Like, what are some things you want to do? What are some things you want to accomplish? Do you want to stay in your house you are? Do you want to not stay? What are those kind of different dimensions to have? And these are difficult conversations to have.
Mm-hmm.
But I think they're important conversations to have, and the more we have them, the more the less awkward hopefully they will get to have. But definitely putting structures in place, asking people who's in their social network that you can talk with to see how they're actually doing. Sometimes people, when you're at a distance, they don't want to tell you if things are going wrong. But because like, why bother? What are you going to do? You'll just worry about me. We got it handled, things like that. Maybe there's other people to involve in that conversation as well.
So are there any general strategies you would advocate to get other family members more involved, not just in the conversation, but actually in the care?
When there's acute events, often people come, there's a phase where you get a lot of help, right? Often. And where it starts fading is over time, even though the care needs may not necessarily change, sort of the people kind of go back to the things that they're doing, their own lives. And that's, understandable. So I think one important strategy is when people are reaching out to help, see if there's a long-term plan that can be developed. If somebody's going to need care for that, let's say chemo for the next 8 months, chemotherapy for the next 8 months, then maybe have it like, right now we don't really need much, but I think we have it covered. But can we, is it okay if we kind of reach out to you in 2 months' time or whatever? Because at some point for people, it will fade in their background, right? Because it's not for the extended network, because they're doing other things. So that's an example of some strategy when there's sort of acute event where suddenly there's a lot of help. For things that kind of are slowly deteriorating, having some of that conversations again early to say, my partner is just, I've been noticing they're doing be able to less and less. And I'm wondering if, occasionally, would it be okay? Would you be able to take them to a doctor's appointment? And be more concrete. I think the flip is also true. I mean, I think I've been sharing more about if you're a caregiver, what you can do. But a lot of us are kind of both, right? We're gonna be caregivers, but we also observe other people providing care. We need care. So I think being more proactive in those places too, to say, instead of saying, how can I help, to be able to say, I want to drop off a meal for you. I want to arrange dinner for you. Give me a day in the next week that I can make that happen, or I want to take, I'm happy to send somebody over to clean your house. What's a good day for that? So I think taking the burden off the caregiver of asking for something can be really useful for the caregiver, because you can be very specific of, and then it's not so much people are asking because they might hesitate. They don't know what your time bandwidth is. They might not know what resources you have to offer. But if you give a very concrete suggestion, like a dropping off a meal or taking something, then people can be like, oh, okay, great. I do need help. Why don't you take so-and-so to the doctor's appointment tomorrow? I have a really important meeting, and, that way I can go to my meeting and they can go to the doctor's appointment. Those type of kind of concrete offers can be very helpful for caregivers.
I'd like to get to, we have a few more minutes, at least 2 or 3 other questions here. So one of the things you brought up in your talk, Ranak, was the issue of mental health problems of various kinds, whether it be depression or dementia, et cetera, especially with age. The question here concerns is from an adult who's got an aging parent. And the question is, what's the best practice I can use as an adult child to deal with the mental health problems of my aging parent?
There's just so much in that. I'm trying to figure out what can be the most useful. A lot of times it's really challenging to frame it as a mental health issue, especially if there's a generational and cultural barrier to recognizing things, because it can be sort of seen as either you're just telling me I'm crazy kind of framing, or it can feel that, you're kind of less than. So it's a very sensitive conversation. I think staying with observations of behaviors can be useful. Instead of saying you seem depressed, be able to say, I've been noticing that you're crying a lot more easily than I ever remember you crying, or you just seem more sad than you used to, or you've always worried about me, but I feel like you're worrying about me a lot more.
Mhm.
And so maybe making it more concrete again, and making it not say, I think you have depression or that you have dementia, but to really do it in the framing of what is it that you're actually observing that you're concerned about? Because then it becomes a more of a connecting with the human emotions often, or I feel like you're getting a little bit more forgetful. There's aging with forgetfulness, but I wonder if, we should, get that checked out, that type of thing.
Mhm.
If you face resistance, even with that framing, which often people will, or they might say, oh, and then you can say, well, yeah, I can, I see that, but everybody sort of experiences these are tough times, and obviously there's, people get lonely a lot, and I'm wondering if you're lonely, should we talk? So I think having that labels be more about human experience rather than diagnostic can be really helpful. So I've seen that, notice people you haven't really visited so and so, or some groups of friends haven't gotten together. Do you want me to arrange something? Are you missing them? And kind of framing it that way can be possibly helpful.
Good, thank you. Let me see if I can sneak two more, just a minute on each.
Absolutely.
Okay. So have you seen therapy or Eastern medicine be helpful for people experiencing chronic pain?
Therapy is helpful for chronic pain. So pain is biopsychosocial. There's a biological component, psychological component, social component to pain. And so I'm a health psychologist, and so there's a lot of really great evidence-based behavioral treatments available for chronic pain issues. And if whoever has a question, if they want a back channel, I can try to find them, or maybe somebody in the Stanford Health Library may have actually excellent resources around that. There's a lot of pain experts that exist, pain psychologists who also exist, who specialize in those strategies. The other question part was Eastern medicine.
Eastern medicine.
I don't know if that's not my area, so I can't really speak to that. I mean, if the Stanford Health Library has resources around that, maybe Jillian or Amy can help with that. That's not my expertise.
All right, so there's one last one, and this goes back to some data you presented in your talk. Can you unpack the stats ratio going from 7-to-1 to the lower numbers? Why do you have that trend? What are US and India different? And how do you like to think if policy, can you talk about the policy to solve for this dilemma?
Yeah, small question to squeeze in the last 35 seconds. So the numbers are shrinking because people are having, the size of the families are shrinking. And people are, more and more people are opting not to have children. So the intergenerational care is the landscape is shifting in the United States. That is a big issue. Along with that, the population aging is increasing. So the number of people who are now are alive after 80 is going up. So we've gotten really good at increasing longevity of our population. So both of those are playing a role in that ratio. So more people who will need care, and fewer people who are in the next generation, because intergenerational care is often and partnered care are often the two big buckets of informal care people receive. There was, I have no idea the India numbers. There's not really great epidemiological data, unfortunately, coming out of India or other South Asian countries. I wish that was not the case. So I can't really speak to whether those ratios are same or different in India. From a policy perspective, I think that in the United States, we have a double whammy. Is we don't have social policies like other European countries do that support the social pieces like health insurance, socialized, providing healthcare for all, things like that. So that's one. And then on top of that, we have this highly individualistic culture. And so the combination of not having social policies to support support families, and this idea that we should do it alone, kind of combines to make for a particularly bad situation in the United States. So I think an important policy is to change that, right? So if we're going to maintain the high individualism, then we need better supports for people who are providing unpaid care. Make sure that they have other benefits, they get paid to provide care. There's other social institutions that get set up, that long-term care is available, respite care is available, and that we have a better regulated and workforce that is providing home health aid, because that's not a very well-regulated industry. And so there's a lot of variability in the quality of care that people provide in those roles.
So it's a multi-pronged solution, which involves community, state, local, federal government. And so
Yeah, exactly.
It's a long-term solution that you look
at. And so the policy implications are huge, and a lot of really good people have been working towards this for a very long time.
Wonderful. We could go on much longer, but we've run out of time here. So I just want to thank you, Ranak, for an excellent presentation and a very valuable discussion. Hopefully we got to most of the questions that our audience had. As Ranak pointed out, if you have further questions, please send them in to us at Sukham through our website, sukham.org, or you can contact Ranak directly, and we'll try and get more answers to you. I also do want to thank Jillian and the Stanford Health Library for hosting our session today. And I think we should respect everyone's time and call this closed. Thank you all for coming, and enjoy the rest of your evening.
Thank you, Makund, Jillian, and Amy, and thank you everybody for attending. Have a good evening.